Introduction to an IV administration set. IV administration sets will often come in packages that look like this. On the back, you should note what type of drop set you're dealing with. In this case, we have a 10 milliliter drop set. What this means is it'll take 10 drops in our chamber to make 1 milliliter of fluid. These can often come in different sizes as well, such as 15 and 60 milliliter drop sets. Open your package and uncoil your IV tubing. Starting from the top, we'll review. There's a protective catheter that protects the stay-around portion of the spike that will go into the IV bag to allow fluid to be administered into the chamber and then down through our IV line. The fluid will typically be about halfway up, and this is where our drops will occur, so we can see how many drops a minute we're administering. On the side, there's an air port that opens up to relieve any pressure that's inside, causing an airlock. Working our way down, we have a proximal medication administration port. We can attach a syringe onto this and administer medications if need be. Going down, there's a separate specific piece of plastic here that you can actually push or pull towards you to kink off your IV tubing to stop flow. After this, there's our roller dial or clamp. Our roller dial or clamp allows us to control our flow from our chamber of how many drops a minute we're administering. We can roll down to clamp it off to administer a slower rate, and we can roll it up to administer a faster rate. Near the end of our IV tubing, this will be the portion that's closest to the patient. We have another IV medication port that we can attach a syringe to and administer medications if need be. And then finally, the part here that actually connects to the patient's IV catheter. This is a stopper, so then when we're spiking our IV bag or filling our line, which we'll cover in a separate skills video, that it doesn't drip everywhere or spill out. This simply unscrews from the top, exposing the portion which connects and attaches to the patient's IV catheter.